Which of the following method or methods is or are used for identification of the infecting microorganism or microorganisms prior to initiation of specific antimicrobial therapy? I mean, which diagnostic tests are used among the following before initiation of specific antibiotic therapy? So there are options given. Culturing, PCR stands for polymerase chain reaction, MALDI-TOF MS, matrix assisted laser deionization and ionization. TOF stands for time of flight, and MS stands for mass spectrometry. So this is also a method of identification of microorganism. The option D is both A and B are true, and E is all of the above. So the correct answer in this is E. All of the above testings are employed in identification of the infecting microorganism prior to initiation of antibiotic therapy. So the second MCQ, which of the following antibiotic or antibiotics is or are efficacious in the treatment of MRSA, that is methicillin resistant Staphylococcus aureus infection? Options are linezolid, clindamycin, daptomycin, cefazolin, and all of the above. So the correct option is all of the above. And now the third MCQ of this video, the important factor or factors that significantly influence the frequency of dosing of antimicrobial agents. Option A is concentration dependent killing of pathogens. Option B, time dependent killing of pathogens. C is post antibiotic effect. D is both A and C, and E is all of the above. Actually, all of the above factors will influence the frequency of dosing of antibiotics. So the option E is the correct answer. Now moving on to the next MCQ, all of the following are gram-negative pathogens except E. coli, Haemophilus influenza, Salmonella typhi, Listeria monocytogenes, none of the above. Actually in this we are asked to identify a pathogen that is not gram-negative. So in this case Listeria monocytogenes is the correct answer, because Listeria monocytogenes is a gram-positive bacterium, while E. coli, H. influenza, and S. typhi are gram-negative. So the correct option is D. Now the fifth MCQ, red man syndrome is seen with rapid infusion of isoniazid, rifampicin, vancomycin, chloramphenicol, and erythromycin. So the correct option here is vancomycin. Vancomycin can cause red man syndrome if you infuse it rapidly. So vancomycin is the correct answer. Now the next MCQ, among the bisphosphonates mentioned below, which one is the most potent? Options are etidronate, alendronate, risidronate, zoledronic acid, and tyludronate. Now the correct answer is D. Zoledronic is the most potent bisphosphonate among these options. Now the seventh MCQ, through bone remodeling, it takes approximately how many years to renew or replace the entire skeleton? So we are given these options: 5 years, 10 years, 15, 20 years. This does not happen. Now in this case it takes approximately 10 years to renew or replace the entire skeleton through bone remodeling. So now we know the correct option, that is B. Now the 8th MCQ, the calcium supplement of calcium citrate for osteoporosis contains how much of elemental calcium? Actually the supplement that comes of calcium citrate is 21%. So the correct option is B. It is 21% calcium citrate. So it means if we have 100 gram of calcium citrate, then in this only 21 gram is elemental calcium. Now moving on to the next MCQ. For prevention of osteoporosis, calcium supplement of calcium carbonate is used. Which of the following statement or statements is or are correct about it, about the calcium carbonate? So option A is it contains 40% of elemental calcium. This is true. Should be taken with meals for best absorption. This is also true. Produces side effects of gas and bloating. Yes, this is also the correct fact about calcium carbonate. Both A and C options are correct, and all options are correct. So now we know that all options are correct. Now moving on to the last MCQ of this video. There is one anti-osteoporosis agent in the following list whose dosing frequency is once per year. Which is that? These are all actually anti-osteoporotic agents. And we are asked to identify one whose dosing frequency is once per year. That is, we will give this drug only once per year. So which is that? Options are etidronate, alendronate, risedronate, zoledronic acid, and tyludronate. Friends, as we have learnt in a previous MCQ that the most potent bisphosphonate is zoledronic acid. So it is actually this option that is the correct one. So now we know that zoledronic is the most potent bisphosphonate, and thus it is given only once per year. So this was all for now, friends. Thanks for watching. I hope you have liked this video, and please, I request you to subscribe to this channel so that you will get notified for the upcoming videos like these. So thank you.